Hi, Barbara Allen here, author of the book Conquering Arthritis. Today I'm here to tell you about my #1 secret for healing rheumatoid arthritis. It's contained in this arthritis drug guide, and if you watch till the end of the video, I'll show you how to get a free copy. Before I reveal the #1 secret, I want to mention to you that I have a video here, a DVD, that reveals my 17 secrets for healing rheumatoid arthritis. And this is a combination of what I've learned writing the book and healing myself, plus what I've learned in the last many years coaching people through the same process. So it's a wonderful, wonderful overview to the book. It makes a great companion with the book. And together these secrets have the power to heal what normally is considered incurable. And I've also created, and this is something I'm so very excited about, I've also created a coaching course that will take you, it takes several months, and you'll get content delivered via video each week, and it's on a blog format as well, so you can ask me questions and I can write out the answers or perhaps even create videos if that's the most appropriate way to answer, so it is interactive. So I've got a coaching program that you can enroll in for a low introductory fee so that you can see if it's for you, and then if it is, there's a low monthly fee that you pay each month to continue in this course. And the feedback for the few people that have already tested this content is that it has been life-changing for many, many people. So I really encourage you to enroll in the coaching course long enough to see if it's for you, and if it's for you, take that extra added help to take you all the way back to health. So without further ado, what I'm now going to do is talk about my #1 secret for healing rheumatoid arthritis. Hi, Barbara Allen here, and I'm back with my #1 arthritis secret revealed. First thing you need to know is why conventional arthritis treatments seldom work, and it's because arthritis drugs only suppress symptoms. They do not correct the underlying causes of arthritis. It's unbalanced digestive, elimination, and immune systems that cause arthritis. Conventional drugs and surgery do nothing to help bring these systems back into balance. Drugs and surgery can actually harm these systems as well as others, making it harder to heal. However, drugs can be useful. Pain relief is a really important thing sometimes, and slowing or stopping joint damage is invaluable, and that's a service these drugs can provide. But remember, pain relief and the slowing of joint damage are not the same as a cure. So there are 4 classes of arthritis drugs: the non-steroidal anti-inflammatories, of which there are 2 types, the analgesics, the corticosteroids, and the disease-modifying anti-rheumatic drugs, and I'll talk about each of these classes. The first one are the non-steroidal anti-inflammatory drugs, and they are the most commonly used drug to treat arthritis. They reduce inflammation and they relieve pain, so those are 2 good things. And they're available over the counter as aspirin and ibuprofen and many other forms, as well as by prescription only. So conventional non-steroidal anti-inflammatories, what's not so great about them is they cause stomach damage. And they almost always cause acute lesions in the stomach and small intestines, and about 50% of people with these lesions don't even know because they're not causing stomach pain. The damage increases intestinal permeability, and it can take months to heal after you stop taking these drugs. So they're not so great. And they're not so great in part because this increased intestinal permeability, known as leaky gut syndrome, makes arthritis worse and harder to heal. Large amounts of food particles leak out into the bloodstream. The immune system reacts. This in turn creates even more food sensitivities and more inflammation in the body. So instead of calming inflammation, ultimately you're revving it up. So the second class within, or subclass, are the COX-2 inhibitors. They first came onto the market in 1998. They were promoted for not causing stomach damage. but many were pulled from the market. Vioxx in 2004, Bextra in 2005, and the only one still on the market is Celebrex. So they're not so great either, and the reason why is they increase the risk from death from stroke or heart attack. There's still debate going on over the safety of using Celebrex long term. There's one New Zealand study that found that Celebrex is no safer than Vioxx. So I've got many examples of nonsteroidal anti-inflammatory drugs here by both their generic name and common trade names. And what I recommend is getting my free drug guide so that you have this whole list. The next class is the analgesics. They're okay for short-term pain relief, but they do not reduce inflammation. They do not heal arthritis. And acetaminophen or paracetamol, also known by the trade name Tylenol, is the most common of this group. And they're not such a great idea either. Turns out that they can make it harder for your body to heal joint damage. It's because the body processes analgesics through a reaction called sulfation. This process is the same one needed for joint repair. So if you're taking high doses of an analgesic, it's keeping your body from repairing the joints. It's keeping the enzyme that would normally repair your joints busy with detoxing the drug. The third class are the corticosteroids. This is a feel-good drug, and it's very useful for disrupting a period of high inflammation and pain. So it has a very limited use for that. Common oral forms are prednisone and the others I list. And prednisone is commonly injected into joints, and people often feel like a miracle has occurred once they've had one of these injections. But they're not so great, and this is why. Getting prednisone injections often causes osteoporosis. It impairs your ability to fight infection as well as your ability to develop symptoms when you have an infection. And they can also cause swelling, weight gain, redistribution of fat, thinning of skin, as well as some other serious side effects. The fourth class are the disease-modifying anti-rheumatic drugs. They used to be prescribed only as last resort, but now when used aggressively, it's been found that they can help slow joint damage, and this is very important. And they can be valuable for slowing, even though they can be valuable for slowing the damage caused by arthritis, this should not be mistaken as a cure. They don't work for everyone, and sometimes they're too toxic to use, but if they do work for you, they can be a valuable part of buying you time to find something that will help you heal. So they're not so great. The reason why is they're toxic. Some cause birth defects, others eye damage, others cancer, others suppress the immune system and the ability to create blood cells. Others of these increase the risk for infection and are hard on the liver and kidneys, and each of them throw the body further out of balance than it already is. So here's a list of different ones in this class. It's a very broad class. Methotrexate, sulfasalazine, Avara, gold shots, penicillamine, tumor necrosis factor inhibitors, also called the biologics. That includes Enbrel, Remicade, Humira. They're the soluble interleukin-1 receptor therapy. They're the anti-malarials. They're the cytotoxic agents. So if you want a full list of those, get my free drug guide by clicking on the link below. So which classes of arthritis drugs can worsen arthritis? The non-steroidal anti-inflammatory drugs can make arthritis worse because of creating leaky gut syndrome. The analgesics can make it difficult for the body to repair joint damage by dominating enzymes that you would normally be using to repair these. The corticosteroids can cause osteoporosis, so that's not so great. But the corticosteroids can be useful in breaking a cycle of high inflammation, so they actually do have a place in arthritis treatment. And the disease-modifying anti-rheumatic drugs don't seem to make arthritis worse, but they are toxic, so they're not a good long-term solution. So if you like this secret, I have 16 more that are just as good. Together they work better than any one secret alone. To get all 17 secrets, click on the link below this video. To get my free drug guide, click on the link below this video. For my Arthritis Secrets coaching, which will take you step by step through the 17 secrets and help you implement each one, click on the link below this video.